It's something that we do in terms of monitoring the patient-reported outcome measures. At an academic center, you certainly have that, but there are you know, probably a dozen or 2 dozen centers that might be doing this in a very systematic, consistent way. Um, but that every individual with myasthenia gravis might not be going to an academic tertiary care center, and their neurologist might not be following their MG as closely with some of the outcomes that we have and find useful in caring for individuals. So I think having a dashboard report of the clinical outcome measures from the patient perspective is useful and helpful and can kind of allow for us to see how patients do over time. I think that all of our patients are partners in their own care, partners in research. Without them, we can't do any clinical research and we can't advance the field. And so I think patients are also getting more sophisticated. There's a lot of information online. Many patients come well-informed, sometimes misinformed, because there can be misinformation online as well. And I would say that we spend a lot of time counseling patients about their condition, counseling patients on therapies that are available to them. And I think working together to push the needle forward to improve clinical care is important. There's a number of knowledge gaps, certainly. When we have one treatment, well, it's okay, it's one treatment. When we have 2 or 3, it's also not too complicated to make a decision. But now and in the coming next few years, there's going to be a good number of therapy options. We do not have a way, nor do the clinical trials inform us as to how to treat patients in a personalized way. So we don't have predictive biomarkers to do that. We don't have even predictive clinical characteristics that would allow for us to kind of put patients into certain groups that are more or less likely to respond. And I think that's something that would like to push forward. The registry is an attempt to collect robust clinical data longitudinally to help address some of those knowledge gaps, most certainly. It's complementary to some of the clinical research and translational research that's being done at academic centers, not only here in the United States, but across the world. And I think that, as Paul said, there's a number of stakeholders. Patients are probably stakeholder number 1, I would say. But we have pharmaceuticals, we have the advocacy groups, we have the physicians, doctors, researchers. I think we're all sort of stakeholders in terms of our improved understanding and improvement in patient care and improvement in application of therapies for our patients. We want to do the best job we can. And I'm speaking from a clinician's perspective for our patients. That's kind of our motivation. This registry is a platform and a tool that is immensely useful in that endeavor. And I think with the MGFA's commitment to it, it's sustainable. It's not something that, hey, it's starting and stopping in a couple of years, but rather, I think there's a commitment that it will be sustainable for many, many, many years. It's been